Hello everyone, this is Dr. Mark LeMay and welcome to the Wellness Connection. Today we have got a special episode for you. I have a special guest here that I saw at a seminar. I attended a seminar about 2 weeks ago here. So what I want to do here is just kind of welcome Gerald Roliz here to our show. And I also want to read you his bio here so you understand what kind of an expert he is and how good he really is and why I keep on going to his seminars. This is like my 5th time I've seen him. So Gerald Roliz is a certified nutritional consultant whose unique approach to whole food nutrition allows him to advocate reversal, not just prevention, of health challenges brought on by poor nutrition. He holds degrees from UC Berkeley in psychology and molecular and cell biology. Gerald worked as a pharmaceutical sales rep for 5 years, teaching medical doctors about drug-to-drug interactions, adverse side effects, and withdrawal symptoms caused by commonly prescribed pharmaceutical medications. So welcome to the show, Gerald.
Thank you for having me. Appreciate it.
Oh gosh, I mean, it's like, this is so good to have you here because again, it's like the seminar that I went and attended a couple weeks ago here, it's like the Nutritional Solutions for a Pharmaceutical World was an excellent seminar. I got a lot of information out of there and so much that I wanted to share some of the, principles, and I want them to hear from you too, some things that I thought would be very beneficial for my patients and also for the other people who actually watch our show. So the first question I have for you is, so what is something simple people can do to get them started in the right direction, going from being on pharmaceuticals to being, more on the natural side?
Right. Yeah. And, I came from that other side. I was pushing pharmaceuticals. I was interacting with medical doctors. And now I primarily interact and teach an amazing group across the country of chiropractors, acupuncturists, natural health practitioners. So the first off, I want everyone who's actually watching this, if you are taking a pharmaceutical or multiple pharmaceuticals, always work with your prescribing physician for any dosage adjustment, okay? There is a high risk for withdrawal syndrome should you stop these cold turkey without any supervision. And what withdrawal syndrome can be is extreme discomfort, okay? So for anyone who's there now, all right, let's start with first things first. The first step is always work with someone who's actually truly dedicated to the healing profession, just like, yourself, Dr. Mark LeMay, or someone who's in your area to work with you in providing natural solutions. And I would recommend that everyone can start off with the most simplest upgrade to their diet, which is simply just eating a healthy protein at every meal. Most of my clients personally, I have found just don't consume enough protein. And we need protein because that is a major building block of literally every organ, every tissue. And also, if we think about our mood, amino acids are the building blocks of neurotransmitters. And most of my patients who have instability in mood, they're just not consuming sufficient amounts of protein, and they're over-consuming other carbohydrate, rich foods, and that's an easy switch that most people can do. So right away, start finding someone that can be part of your health team, then start eating regularly healthy proteins at every meal, and then make sure you're working with your the prescribing physician for any dosage adjustments.
Yeah, great idea too, Gerald, because again, that's one of the things that I learned from you. So I'm making sure people eat enough protein because it's amazing, because I had a 15-year-old come to me like 2 months ago, and the main issue with him is he was not eating enough protein and fat. Once we got him eating more protein and fat, guess what happened to his whole condition? It got way better. He grew like an inch in 2 months. Whereas before, he didn't hardly grow at all because his diet was mostly carbohydrates. And so he goes, wow, it's like, this stuff really works. It's like, yeah, it does. It works beautifully when you do it correctly. So good. Question number 2 for you is, and this is really interesting because, I'm a member for Kaiser, and I thought, I'm going to get on their website and I'm going to check out, they have like an area that you can go check out like natural, solutions or different like products. So I went and looked up one of my 2 favorite herbs that I like to use in my practice from MediHerb. One was ashwagandha, and the other one was echinacea premium. And it was really interesting to see their kind of like their rating system that they have. And it's like ashwagandha got like out of 10, it got a 6.
What?
And I know, it's like, well, and again, they base it on, it's like, is it effective? Are there, safety concerns? Are there interactions with medications? You know, and again, they show that there's really not much data, according to them. There's not a whole lot of data as far as like, you know, the efficacy or, you know, efficacy of these herbs. And I'm like, wait a second here. I look it up over in this book over here by Carrie Bowen, who wrote the, you know, the book on this. And this is over in Australia. And so there's all this clinical data in there. And it's like, so what's the deal here? So why is there so much misinformation about, you know, standard processed products or MediHerb products out there online? Why is that? You know, I want to get your perspective.
Yeah, you know, as a former pharmaceutical sales rep who had a, you know, a stake, an ownership in certain shares of the industry or certain company, you know, they're very focused on profit, and anything that can potentially threaten profit is at risk of being mocked or possibly badmouthed. And in this situation, I mean, when you said it got rated as a 6 out of 10,
yeah,
I mean,
out of 10.
Obviously someone didn't know how amazing this herb is, ashwagandha. Now, you know, and for anybody who's interested in experiencing herbs, just keep in mind that we're all herbalists. We all make green tea. You know, we all take an herb and infuse it with hot water to extract the phytoactives to give us you know, a healthy benefit. And so everyone's an herbalist. And, you know, we cook even with certain spices, which are culinary herbs like turmeric,
Yes.
cumin, rosemary, dill. These are paprika. These are actual herbs. Garlic, leeks. You know, these are herbs. So, you know, a lot of individuals are scared of herbs, and what has happened is we've gone away from using them in our cooking as well as in for overall restoration of our health. And you know, ashwagandha has its roots to Ayurvedic medicine, and it's been around for centuries. You know, pharmaceuticals have been around for at most maybe 200, 230 years. And what happens is that you know, when people realize that all pharmaceuticals have side effects, and some of those can actually lead to a disease. So some of these side effects can actually be diseases, and that term is called iatrogenesis. But what we don't realize, and I actually had to study this, I had to learn this, that most pharmaceuticals have been inspired by herbs. In every pharmaceutical company, they have a team of these specialized pharmacists called pharmacognosy specialists, and they go out to the Amazons, they go to any rainforest, they go to India, China, and they hang out with all the herbalists, and they take this herb back to their labs, find an active phytonutrient, and then they create a synthetic version of it, because you can patent it. And anything you can patent, you can generate, you know, immense amounts of revenue from. And so that's how the pharmaceutical industry works. Now, don't get me wrong, there's strengths in the pharmaceutical industry. There, you know, my brother's a firefighter and a paramedic. That is the best time to implement Western medicine. But in terms of herbology, everything has existed for centuries, well before the Homo sapien ever existed. And we've evolved, you know, or we've coexist with these herbs. And so anybody who says that it's less than a 10, I would look at a couple things. Number one, what's their knowledge base on the herbs? Do they actually know about them? And number two, is the source of the herb actually what it should be for the human to see a beneficial effect? And that's something that you and I have access to. We have access to the high quality practitioner grade herbs. We're also knowledgeable about how to use them. And herbs don't have these drug-induced diseasing, you know, doesn't have the ability to create diseases that the way certain pharmaceuticals have. So.
Yeah, and I agree with you too, Gerald, because again, the quality of the different herbs that we work with at our practices, it's amazing, because again, it's like, I would have never known, because, you know, I tell people like, oh, you should try echinacea, and they're like, oh, I tried that before, it really didn't do anything for me. I said, well, when you put it on your tongue, did it tingle? Is it supposed to? It's like, yeah, here, let me try this with you. Yeah. They put that in their mouth, and they're like, oh my gosh. It's like, see, that is pharmaceutical grade, you know, the kind of active kind that you want with the alkalidomides that will actually get the result that you're looking for, because that's what MediHerb looks for, the active ingredient from the active, you know, the part you're supposed to get it from. So that's a big difference there. So like, thank you for like, you know, giving us a little bit, you know, open our eyes a little bit wider on what's going on there too. Because again, it is some competition going on here too.
And I have a story to that, you know.
Sure.
Because I've always been open to herbs. I've always had this interest, but I didn't know where to get information, where to get the right information, or where to get the right quality herb. And I remember when I was in high school, I got this flyer in the mail that said, call this number and get a free bottle of echinacea. Well, you know, first off, I was naive. You should never accept free herbs over the mail, you know, from a flyer. And I took that supplement, and it made my scrotum just tighten up for 2 weeks. Now in high school,
Oh my gosh.
I didn't know who to speak with about that. I didn't have an herbalist to consult with. I didn't have a holistic chiropractor to go to. I was, you know, afraid to speak about this with my parents. You know, how do you talk about your genitalia with your parents, right?
Yeah.
But lo and behold, you know, come, you know, 10, 15 years later, full circle, now having the ability to understand certain herbal manufacturers, how they cultivate the soil, then how to extract the phytonutrients, and then how do you detect whether it's actually an active. And the echinacea is one of the most easy examples to know if it has the true active, you know, a true amounts of what's necessary to have a therapeutic benefit of the alkylamides. And that's it's a tingling sensation. And I like to explain that to my clients, that you get the tongue tingling without the mistletoe.
Well, thanks for sharing that personal story. Appreciate that.
Yeah.
Okay, so let's go to question number 3 here. So where do you recommend that someone go to get the right information about, you know, whole food supplements and herbs? Who would you recommend they go to?
And that's a great question, because even myself, you know, prior to getting into the industry, you know, I just search so many websites, and there are many good websites that actually have very valid information. But then you also have other websites that could be somewhat telling putting a darker spin. You know, in pharmaceutical sales, we learn how to spin, and you know, we can always say that this drug causes in 7% of the patients who take it will completely not be able to tolerate the medication because of the side effects being so bad. Of course, when I was a drug rep, we would spin it in that we would say that, 93% of patients could tolerate this drug. So we focus on the benefits.
Right.
So the drug industry can always take their drugs and spin it to a positive. And then we also know that they can always take the herbal information and spin it to the negative. And so that's unfortunate, because most of that is also out there on the internet. And in terms of resources, you know, the best resources are the exact ones that you were showing, that you have in your office. And you actually showed the phytotherapy resources that Carrie Bone, who is perhaps one of the best educators globally on, and perhaps the most knowledgeable on herbology, from knowing what research is available, to how to source the herb, to knowing actually where the herbs are best grown in terms of what soil. So for example, echinacea is best grown in North and South Dakota, but there are many herbal manufacturers, or, you know, some people think that any echinacea online or through the mail is going to be therapeutically beneficial, and lo and behold, it's just so difficult. So I recommend that people first learn about, you know, Carrie Bone and all of his resources, but more importantly, go and find someone who's dedicated a life, such as yourself or myself, you know, or any of our colleagues, who actually has read multiple texts on herbology, have attended seminars taught by Carrie Bone, Lee Carroll, my colleagues, myself, and go to someone who actually is a professional in this industry. And then you can find out actually what herbs is ideal for your specific issue, because not every one person is alike, and some people may need different herbs from the other, and they may have the same condition. So I would recommend that people first start with their local holistic healthcare practitioner, because they're their primary consultant for achieving optimal health.
Great. Yeah, because again, it's like I always tell people, try to find people who really have the knowledge in the area that you're looking for. So, and again, it's like, that's why I go attend your seminars, because I get great information. Same with all the other ones that I attend to, because it's a big help to us as practitioners. Yeah. So, okay, last question here for you, Gerald. Question number 4 is, what would you say is some of the big takeaways that I should really get as a practitioner to be able to really help my patients from the seminar that I attended with you just a couple of weeks ago here? What would you say some of the big things I really should have gotten and implement into my practice to be able to help my patients?
Yeah.
I want to look out for them.
Absolutely. Absolutely. You know, we have a lot of colleagues out there who are doing amazing things. And the one thing that I wish that everyone knew is in a way to kind of see what I see. Because when I conduct an intake for my nutritional clients and I see specific symptoms, and I look at their medication history, I can see that sometimes they're associated. I give you an example. The other day, I had a female client who was infertile, and she had taken birth control pills for 15 years, but had stopped for 3 years and still couldn't get pregnant. And that is a sign that the side effect, well, the actual effect of the birth control pill, right, is to induce infertility, was still having an impact on her. And many of our colleagues, they don't take a medication history. They don't look to see if there was birth control history. And then they try to help the person improve their health. But sometimes understanding what has been taken place in the past can help support what the treatment program is to help that patient achieve what their health goals are. And in this particular case is to actually have a pregnancy. And then, of course, you and I, we already now know how to have that process. And so that's the first area, is to really understand the human being that's in front of you and look at their history as to how they got to where they are today. Because most people out there, most medical doctors are just, tell me your symptoms. What are your symptoms? Okay, here, take this drug, take that drug to suppress the symptoms. And the one great thing about you, our colleagues out there, we go to the root cause. And furthermore, not only from a thorough intake, but we also have the ability to investigate further, whether that's to incorporate blood testing, saliva testing, hair mineral analysis, muscle response testing, heart sound recorders, whatever it may be. We have the ability to continue to investigate what is going on at the root level. And so for any colleague out there, make sure that you're taking a medication history, understanding pharmacology, that some of your patient's symptoms may be actual side effects of the medications they're taking presently or they've taken in the past, and then continue to investigate what is going on with additional tools such as lab testing or muscle response testing. And then from there, you can have that conversation with your patients to tell them, this is where you're at, and this is where you want to get to, and this is what the road looks like. So that's pretty much what I hope everyone is able to do, and to help people, as many people as possible, become healthy and happy.
Okay, great. Well, so I just want to make sure I got this correct, because this is I want to get this. So basically, being very complete with the health history, finding out their past and what's been going on, so that we know kind of like, here's the past, and getting in there and investigating further, because we want to find, again, the root cause. I'm always telling my patients, like, we are looking for the cause, not just to treat your symptoms, because that's not working for you. And then showing them the step-by-step way to get there, so they know pretty much this is what it's going to look like going through this whole process to get you where you want to be, which is your ultimate goal, correct?
Exactly.
That's awesome. Beautiful. So, wow. I tell you what, Gerald, this has been a great time, getting to talk with you about the seminar. And I just really appreciate you taking time, because I know you're getting ready to take off on a big trip here tomorrow, right?
Yeah, exactly.
So I really appreciate you taking time to come and talk to our viewing audience here. I'm sure they really appreciate that too. Now, again, if you like what you've been seeing here, give us a like, give us a thumbs up, hit the subscription notification thing, so we can actually let you guys know about the different ones that we have coming out every single week, because we're doing something every single week, so you guys can keep up on the content every single week. So thank you again, Gerald. Really appreciate you being here. Is there anything else you wanted to say to the audience before we take off here?
For anybody who needs more information on the Pharmaceutical Myth, you can go to pharmaceuticalmyth.com. I'm sure you have it in your office, so any of your patients can.
I've got 3 of them in my office. So it's like, that is a great book. I've read it twice, so I've gotten a lot of good information out of there. So again, Gerald, thank you so much for attending here today. Everybody, thanks for attending the Wellness Connection. We will see you next time. Bye-bye.
Bye, everybody.